morning. Welcome to our next exciting announcement. Breaking ground on our new health campus allows us to connect to the Oshkosh community, and at today's event, we do want to call out that you will see and hear some of those local connections. Our coffee and treats were provided by Carmel Crisp Corner, and I'm sure you noticed the great music from Sunday and Mr. Gessel, who are local to the Oshkosh area. We appreciate these special connections to the community, and we look forward to many more partnerships in the future. Now, to kick off our groundbreaking, I would like to introduce Kathy Jacobson, CEO of Froedtert ThedaCare Health.
Good morning, everyone, and thank you so much for coming out here. Literally, the sun decided to shine on us, and the rain decided to clear. So just a fantastic way to start our day. I also have to recall, Oshkosh is always going to be special to Froedtert ThedaCare because Dr. Andrabi and I stood here in October of 22 and actually announced our first partnership. And that first part of that partnership was really grounded on building this facility that we're now back here today doing this groundbreaking. So Oshkosh will always be a special place for Froedtert ThedaCare. So this is another exciting day in our evolution. So today we celebrate the groundbreaking of this new health campus right here in Oshkosh. When complete, this campus will have an emergency department and ambulatory care services to expand convenient access to care for those living in the region. And as we celebrate the beginning of this project, it comes at an encouraging time. Because on January 1st, Froedtert Health and ThedaCare finalized our agreement to actually bring that partnership together and come together as one organization. So in 3 short months, we've been really busy. We've had an opportunity to break ground on our health campus in Fond du Lac a few weeks ago, and we've also announced the inaugural board of directors for Froedtert ThedaCare Health, as well as our North Region board of directors. And as one team, we've also been focusing on advancing our work and making the combination a reality while continuing to provide care for our communities and empowering each person to live their best unique life. We will continue to strengthen local health care, working closely with the Medical College of Wisconsin to bring together every aspect of care, including primary care, specialty care, the most advanced levels of care available, quite frankly, in the country, clinical trials, graduate medical education, and more. We are reinventing healthcare by becoming a proactive partner in health. We are confident our combined health system will continue to improve health and well-being for everyone we are privileged to serve, in line with our long-lasting commitment to our communities. This health campus is one of the ways we are advancing healthcare for the people in the Oshkosh area. It's a natural extension of the trusted medical care we have been providing to the members of this community for a number of years. ThedaCare has been serving the Oshkosh community through a surgery center, primary care, pediatrics, imaging, cancer care, physical therapy, home care, hospice, and more for several years. This new campus is part of a vision of us providing better and more seamless local access to care. So now I would like to introduce my partner, Dr. Andrabi, president of Froedtert ThedaCare Health, who will tell you more about this new health campus. Thank you.
All right, good morning. I agree with Kathy completely. There is a sign out there. The sun is out, the rain is gone, and only for this time. It's going to come back again later today. So this must be a good sign. I also remember Kathy and I standing here in 22, starting our partnership. And actually, we were reminiscing yesterday in another community that somebody came up to Kathy and asked, "Are you guys going to be doing something more?" And the honest answer at that time was no. This was what we were thinking about doing as a partnership. And one thing led to another, and here we are as Froedtert ThedaCare Health. I'm extremely honored that all of you took the time to be here this morning. All of this is part of improving the health and well-being of our communities and empowering each person to live their unique best life. That's what we are about, and that's what we are trying to do. When we announced the plans for this health campus, the idea was really to understand what the community needs are and to be able to meet those needs appropriately. That is the essence of the population health strategy that we've been on for a long time, both Froedtert and ThedaCare Health, creating value for the communities that we serve, truly understanding the needs of the community and then meeting them appropriately where it makes sense. You know, we often, both of our organizations, as now they've become one, have never been sort of traditionalists. We do things a little opposite to what everybody else does. And so as everybody in Oshkosh wanted to go west, we said, we're going to go east. Because guess what? 73% of the people of this community live on the east side. So as we put this campus together, you know, nobody's going to be more than 15 minutes away from a hospital or an emergency room, and that matters. Because it's part of making healthcare convenient and easy and make sure that people have access to excellent care right in their neighborhoods where they live and work. So to ensure access to high quality care, ThedaCare and Froedtert sort of as an integrated system have the ability to do everything from preventative care to primary care to secondary care to very complex quaternary care that can be available within a single health system. And as Kathy said, making sure that not only do we have that, but we have the access to research and education and clinical trials, and all of those things bear on the health and well-being of the communities that we serve. So as we begin our work, Kathy and I would like to share some renderings with you. I'm going to be Vanna for Kathy, and I'll have Kathy unveil some of the renderings for you. Now if I can remember this correctly. It looks marvelous. So this is the new rendering of what the campus is going to look like. You will see some additional renderings on the monitors, so please take a look at that. You know, as we were putting this together, as is our practice, again, making sure that we are getting input from patients, getting input from our caregivers to make sure that we take their needs and requirements into account as well, so that the design is set in a way that puts the patients and families first in everything that we do. The campus is going to be located right here at 250 West 6th Avenue on Fox River in downtown Oshkosh, and will complement the area's major developments, including new condominiums, restaurants, and more. So not only is this a healthcare development, hopefully this becomes an economic development engine for this community as well. This smaller scale modern community hospital will offer easy around-the-clock access to emergency and inpatient care in an inviting, highly efficient setting. It'll be open 24 hours a day, 7 days a week, 365 days a year. That's what healthcare needs to be. When complete, the Oshkosh campus is expected to be approximately 85,000 square feet with an estimated investment of $84 million to bring to this community. Next, to share the voice of the Oshkosh community, it's my pleasure to ask Mr. John Feifer, who is a member of the Froedtert ThedaCare Health Board and President and CEO of Oshkosh Corp, to come up and say a few words. John.
Good morning. I am absolutely delighted to be here today. As Dr. Andrabi said, I'm the CEO of Oshkosh Corporation, but I'm also a board member of Froedtert ThedaCare Health. And there is an enormous amount of commonality in purpose between Oshkosh Corporation, a large industrial company, and Froedtert ThedaCare Health. At Oshkosh Corporation and at Froedtert ThedaCare Health, we always focus on what matters most, and that is people and the purpose of our enterprises. At Oshkosh Corporation, we focus intently on those everyday heroes in our communities who are doing the toughest work that there is. And it is, in most cases, the most dangerous work in any of our communities. And we say to ourselves every day when we come in, it is our job to make sure that every firefighter, every soldier, every construction worker, every environmental services worker, and every person working a tough shift on the tarmac of an airport comes home safe, comes home healthy to their families. Today, this morning, you've already heard Kathy Jacobson and Dr. Andrabi talk about the powerful purpose of Froedtert ThedaCare Health. That is allowing people to live their best lives. That is a very powerful and a profound mission that drives everybody in the organization on a daily basis. You'll also hear from time to time, probably more often than time to time, Dr. Andrabi talk about the purpose of bringing health care to where people are. I think this is a fantastic example of Froedtert ThedaCare Health bringing health care to where the people are and where they need it. This health campus is such a good example of how we're striving to improve delivery of health care in the state, including access to clinical excellence, health equity, and so much more. And myself and the other board members, we are here to ensure that the organization advances its mission of improving community health while providing financial and quality oversight and strategic decision-making. So on behalf of my fellow board members of Froedtert ThedaCare Health, I want to thank everyone who is helping to bring this vision to life, project partners, care teams, and leaders who are dedicated to providing the best care possible for our communities. Now, I want to turn it over to Jenny Nikolai, who's the Vice President of Community Hospitals in Oshkosh and Fond du Lac. Thank you.
Thank you, Mr. Feifer. Good morning. It's great to see all of you here today. As mentioned, my name is Jenny Nikolai, and I have the distinct honor of leading our newest health campuses in Oshkosh and Fond du Lac. As we're planning for the care that will be delivered at this campus, it's important that we understand the people in this community, what is needed today and into the future. Our goal always is to keep care local. Here in Oshkosh, patients will have a new facility that has been designed around them with a modern, streamlined, inviting environment. When complete, the campus will have emergency care, inpatient beds, and 24/7 coverage with board-certified emergency medicine physicians. Plans call for 24/7 CT scan and X-ray, as well as ultrasound, mammography, MRI, and lab services. Also included in plans are a retail pharmacy, ambulatory surgery center with operating rooms, and a medical office building for primary care and specialties, with more services added over time based on the needs of this community. Through this health campus, patients and community members living in the Oshkosh area can expect better health outcomes through expanded, convenient access to coordinated care close to home. And when a higher level of care is needed, our combined integrated organization has the resources needed. On behalf of the care teams who will serve at this campus, I would like to thank everyone who is helping to bring this vision to life. Next, I'd like to introduce Mr. Mark Roloff, City Manager with the City of Oshkosh.
Good morning, everybody. This is an exciting day for us because I've been with the city nearly 16 years now, and seeing this site really transition from an old industrial site into a vacant site that had so much promise and an economic development opportunity, and then to see what we have today, which is an organization with Froedtert ThedaCare that has a commitment to growing Oshkosh, and also, while addressing a very important economic development issue, also recognizing that the health of our community is equally important, and they're really addressing a need right here in the center city. So there's so much to be excited about, and I couldn't have envisioned what was necessarily going to come here to this site when the Geldman site closed about 14 years ago. And what was it going to be? And we created a tax increment district to encourage some development here, and it still was taking some time. And it wasn't until ThedaCare stepped up, and then their partnership with Froedtert ThedaCare is making this happen. This organization took a look at the demographics of our area and recognized, as Dr. Andrabi pointed out, that a lion's share of our community lives east of 41 and has as much right to good, reliable health care as anyone in our community. And this is what they did with their vision. So they took an economic development project and added a healthcare element to improve our community. And for that, I'm going to be eternally grateful to you. There are so many different developments taking place in the Oshkosh area right now. You see it around here. I've been here for several groundbreaking events, including our trail, which was done here about 10 years ago now. So we have a trail that will be a great amenity for your employees who are working here, as well as the public to go by and say, wow, what a nice hospital we have right here in downtown Oshkosh. But we also have some great housing here and some good, strong businesses that are based in Oshkosh. Certainly, Oshkosh Corporation is probably at the top of that list, but we have so many other wonderful employers here that will be able to take advantage of everything that we have here along the river that we've been able to redevelopment. And the challenge has always been, because of our industrial history, the environmental impact that was left by our former legacy companies. This is another area where ThedaCare is stepping up and addressing a significant environmental issue. And again, that isn't going to happen with just anybody. It's somebody like Froedtert ThedaCare that says, we care about this community so much. We will address the healthcare issues because that's the core of their mission, but they're also addressing a significant economic development opportunity in here. But they are, at its core, a health agency, and providing access to health care and emergency care right here in the center city is going to be very important. And if I ever trip and fall over at City Hall, I will only be a few blocks away from somebody taking care of me. And that's so important. So I want to thank you for your trust, for your investment in our community, and your commitment to the health and care of our entire community. Now with that, I'd like to invite my friend Dr. Andrabi back for some final words.
And I have to say, Mark, you've been a great partner from day one. So thank you for your passion for the community and your ability to help us make this a reality as well. I just want to take a moment to just thank everyone who's here today. I also want to take a minute to thank some of our partners who are making this a reality. Hplex Solutions as the owner representative, HGA as the architect and engineers, Myron Construction as the construction manager, the Sigma Group, which is our civil engineer and landscape architects. A round of applause for all of them, please. I also want to recognize, not to embarrass, Andy Levitt, the Chancellor of UW Oshkosh, who's here as well. Hey, Andy. Who's also a great partner with ThedaCare and now Froedtert ThedaCare in terms of our nursing school and many other disciplines. Great education happening right here in this community, and hopefully that conversation and the work that we are doing together continues forward, and we keep a lot of those people that he's graduating within our communities and within our health system as well. As part of this health campus, we plan to add approximately 60 new jobs with respect to caregivers and staff that are going to be part of this campus as we go forward. We expect the campus to be completed sometime in 2025. Mr. Arquilla will never give me a date. I keep asking. So that's the best I can do, sorry. The same thing to be expected in our Fond du Lac community as well. Sometime in 2025, we should be bringing that to completion as well. It's an auspicious day. So glad to be here. We are excited. Everybody else is excited. Let's make sure that we make it great, not only for our organization, but also for this community that deserves to get this level of care right where people live and work. I'd like to now have the speakers come up and be part of the groundbreaking ceremony, if you may. And then we'll have some media opportunities after that, and certainly stay and talk and socialize if you wish to do after that as well. So some people smarter than I, please take over and tell us what to do. Thank you all.